Hi everybody, it's Lee Roberts, Paracare Coordinator for Medical Programs. We're here to provide some time-saving tips to make your Siren PCR documentation easier. Today we're going to talk about the latest update to the PCR Standard Operating Procedure and the added definition of Most Responsible Paramedic. We define Most Responsible Paramedic as the person who is the highest qualified paramedic and responsible for the care of the patient. In most cases, this will be the attendant. However, there are circumstances where another crew member with a higher license level will participate in a patient care event. The more highly qualified paramedic is responsible for decisions on the level of care required. How does this affect your daily practice? On layered calls where one crew member accompanies another crew to the hospital with the patient, an example would be when an ACP rides with the PCP crew, they are permitted to add themselves to the transporting crew's PCR instead of creating a separate PCR. If that crew member is a higher license level than the first crew, they will be the most responsible paramedic and accountable for the patient's care until transferred to the receiving care location. To do this for a specific call, go to the Incident tab in your PCR and select the Vehicle Crew button and choose Crew. Use the regular Siren logon steps to enter the additional crew member. To allow the most responsible paramedic to select assessments and procedures under their name, you will need to change that person to the attendant. Once this is completed, whatever assessments and procedures are selected will then default to the highest level license on the call. To review the PCR Standard Operating Procedure, please refer to the BC EHS Handbook or go to the intranet site under Policies and Procedures.